Good morning. This is David Henry. I'm the communications manager for the city of Amarillo. I want to welcome everyone to today's weekly COVID-19 news conference for the latest information for the Amarillo community. Let me go ahead and briefly introduce who is on our panel today. We're joined by Amarillo Mayor Ginger Nelson, Casey Stoughton, Public Health Director for the city of Amarillo, Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center, Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital, Dr. Michael Lamentier, Chief Medical Officer for BSA, Dr. Rodney Gonzalez, Director of the Amarillo VA, and City Manager Jared Miller. We'll open it up to statements from our panel, and then we'll take questions from our media members. We'll start with Amarillo Mayor Ginger Nelson. Mayor, how are you today?
I'm well, thank you. And good morning, Amarillo. Of course, it's exciting news that the governor made the announcement yesterday that he plans to open businesses 100% next week. And we are celebrating that news. We're celebrating that news for every single business owner. We want them to be open. We want them to be doing business, and we want them to be churning up activity in our economy so that we can be recovering and getting past COVID. So we are absolutely celebrating the opening for businesses. I do think that it's important for us to remember that COVID's not over though. So we need to stay responsible in the choices we're making individually about wearing a mask, washing our hands, not planning events, not going to large events until everyone who wants a vaccine in our community has had the opportunity to get a vaccine. And so if that's you, I want you to take advantage of our awesome vaccine program. Casey's going to give us some statistics on how many people we are vaccinating and just what an impact that's having in our community. One of the things that I continue to tell citizens is check the list, because obviously there's two categories who are qualified for vaccines at this point. And that's category 1A, which is if you're in the healthcare industry or you're a medical worker, then that's you. But 1B is a much bigger category. You're easily in it if you're over the age of, if you're 65 or older. But then there's a whole list of things that might put you into category 1B. And if you haven't read that list, you might be surprised to find that you qualify. And if you qualify, we really want you to come down and get a vaccine. It's good for you, and it's great for our city and our community. The more people we vaccinate, the safer we will be interacting with each other, which protects our businesses, our schools, and helps all of us get closer to being past COVID and back to normal. One of the criteria that's on the list that qualifies people in the 1B category is having a body mass index of 30 or over. So we say that by abbreviating it, we say have a BMI of 30 or over. If you're like me, you don't really like thinking about that topic. I stay away from scales and I don't concentrate on the numbers about how much I weigh, but this is a really important criteria for people. And what we're trying to do is vaccinate as many people as quickly as possible. So broaching that sensitive subject, as it is for all of us, I would say, if you can pinch an inch, maybe you should just run the calculator. And then if you qualify and you have a BMI that's 30 or over, come on down to the Civic Center and get a vaccine, and then move past that number. You don't have to ever look at it again, but we're just trying to get as many people vaccinated as quickly as we possibly can. And so if you fit in that 1B category, I invite you to come down to the vaccine, and you can come down to the vaccine clinic, and you can find out the information about what days we're open and what hours by checking the website at www.amarilloalerts.com. It's free. It doesn't cost anything. And if you need a ride to the clinic, we can give you a ride. You can get a ride from the city there and back by calling 378-3095. And so I really want to emphasize how important it is to check and see if you qualify now. And we're hopeful that they'll soon expand the number of people who qualify, but that's a state decision, and we're waiting on that information. So take care of yourself, check the list for 1B categories, and have a great week. That's all I have this morning, Dave.
Thank you, Mayor. Let's now go to Casey Stoughton, Public Health Director for the City of Amarillo. Casey, how are you today?
I'm well, Dave. Thank you. I'm glad to be here this morning, and we'll talk a little bit about the numbers and then some of the other public health activities. So as of yesterday, there were a total of 33,105 total cases of COVID-19 here in Potter and Randall counties. 16,891 cases in Potter County and 16,214 cases in Randall County. We have a total of 31,811 recoveries, and we're up to 686 deaths here in our community. That leaves us with 608 active cases. At the 2:30 report card, there will be additional cases reported. Each of the cases do represent a unique individual. The rolling 7-day positivity rate is currently at 3%, and the positivity rate at the drive-through testing site is up to 27%, just up from about 22% last week. And the 5-day new positive case average is at 46 new cases per day. Yesterday, our GA32's hospitalization percentage was at 5.42%. That means that 5.42% of all of our hospitalized patients have COVID-19. And while our RAC region is no longer considered an area of high hospitalization, but we are still in status level orange. 2 of the 4 indicators are still in that status level orange area. And so we'll be in status level orange for another 2 weeks. And then at that time, we will look at the indicators, and if we need to move to a different level, then we will at that time. The public health drive-through testing site does remain operational, and individuals can call 378-6300 to be screened and directed to the test site. The outpatient bamlanivimab infusion center will be closing at the end of this week. Referrals can be sent to Northwest Texas Hospital and BSA as part of routine pathways for care. We have served over 153 patients, with only 4 of those patients requiring hospitalization. So it's been a tremendous success at the outpatient bamlanivimab infusion center. I do want to thank BSA and Northwest for their partnership and the staff that have operated that infusion center. So thank you very much to those teams. The vaccine clinic is also operational. To date, the Public Health Department has given it 53,196 first doses and 27,174 second doses of the total 87,950 received doses. We will be open until 5 o'clock today, so come see us if you're a healthcare worker, if you're 65 or older, and if you're 18 and older and have a chronic health condition. Please stay tuned to AmarilloAlerts.com for more information about times, clinic times, and if and when the state does change those, the 1A, 1B criteria, and when we move to 1C. Amarillo Public Health has not thrown away any vaccine. We time our end of clinic day to the drawing of the vaccine so that we don't have any vaccine that's wasted. We have heard concern about this, and it's absolutely false. It's our #1 goal to make sure patients are safe and that vaccine is safe, because we know that this is a precious commodity and we do not want to waste any. So we are not throwing away any vaccine. I also want to let you know that masks will continue to be required at the public health vaccination clinic. This is a place where people are gathering for protection from COVID-19, and it's important to protect those vulnerable people who are coming to the clinic. So we will continue to wear masks at the clinic. It also remains critical to be vigilant in protecting ourselves and each other from COVID-19. Masking, social distancing, staying home when we're sick, and vaccination are the tools in our toolbox right now in the fight against COVID. Even though the mandate will be going away next week, it's critical that we continue to wear our masks, as this virus is not gone. You as a citizen need the data to best make the decisions for yourselves. While the total cases are trending down, we have lost 686 people here in our community. In fact, we lost 16 people just in the last week. That's a lot of people. The fight is not over. So please be responsible. Using PPE, specifically masks, remain the main tool for the majority of our community. So I implore you to just be responsible and consider just continuing that mask use. Thank you, Dave.
Thank you, Casey. Let's now go to Dr. Scott Milton, Public Health Authority, Texas Tech University Health Sciences Center. Dr. Milton, how are you?
I'm good, thank you. Well, the governor's mask order is to be lifted, but COVID has not disappeared. We still have hospitalizations and deaths, and we know that wearing a mask protects those at risk. Here at my clinic at Texas Tech, we will also continue to wear masks because we want to protect our patients, those that are vulnerable to becoming really ill from COVID. Now, that being said, our community is in much better shape. Our numbers are down considerably. Our hospital capacity is more than adequate. We have ample supplies of medications to treat those with COVID. Please remember that none of these medicines are really home runs, though, for those who really get so sick that they need them. So use your head and proceed with caution. Please get vaccinated. Beware of the individuals around you. Try to protect your neighbor. And please think about getting vaccinated. There's more and more evidence that shows how effective and safe these vaccines are. That's all I have, Dave.
Thank you, Dr. Milton. Let's now go to Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital. Dr. Weiss, how are you?
Hey, good morning, David. Well, I am ambivalent, particularly about the governor's declaration yesterday. So first, I am very excited for the businesses that have suffered over the last 12 months. So the bars, the restaurants, the hotels, retail stores, it is fantastic that they're going to be able to open up and do business as they had prior to COVID. Second, I think this is the first major move back to normalcy or some form of normalcy for all of us in this community. And admittedly, it's going to be great to start to see faces again. I guess I will have to start brushing my teeth again. But then on the flip side, I'm scared. I mean, if anything, this virus has shown us that it is a great opportunist. If you give this virus an inch, it spreads a mile. And we know that there's a lot of people in the community that have stayed sheltered and been wearing their masks. And the loosening of these restrictions obviously opens up the possibility of those individuals being at higher risk for exposure to this virus. So that's very important. I think, in that sense, we've got to think about the fact is what do we need to do to protect those individuals? And really two things is, first is even without masks, we must continue a lot of the same hygiene practices that we've done, the social distancing, the hand hygiene, the wiping down of high touch surfaces. So we can continue to keep this virus at bay, even if we see less masks being worn. But second, as we've all talked about, we have got to increase the distribution of vaccines. That is the ultimate secret and essence of protecting ourselves, making sure we're all immune because of the vaccines. But as Dr. Milton said, overall things are looking a lot better. I think it's hard to know when exactly is the right time to let our guard down. And I know the governor and his experts are taking their best guesses. Maybe this is the best time to do it. Now, with regard to the numbers in Northwest, we're looking at a lot better, as Dr. Milton alluded to. Right now, we have 14 COVID positive patients in the hospital out of a census of 232 in the acute facility. So that's 2.8% of our licensed beds are being taken by patients with COVID right now, well below that 15%. Right now, we have 41 patients in the ICU or critical care, only 6 of which have COVID-19 right now. So that's fantastic. We are using 14 ventilators total, only 2 of which are being required for patients suffering from COVID. So all those numbers look great. As Dr. Milton alluded, we have a much better capacity in the hospital in that respect. Our outpatient testing, we had a 3% positivity rate yesterday. We have stayed somewhere between 0 and about 3% over the last 7 to 10 days in outpatient testing. So again, showing that there's a much lower prevalence of the virus in the community right now than we'd seen several months ago. Now, we did have a total of 23 people lose their life in February to COVID-19. And again, that continues to be a lower number than we see in previous months, but still way too high. And we hope that March will even be better for us there. Now, with regard to the remdesivir, the drug that we're using in the hospital, we've treated a total of 728. Only 2 patients right now are currently on that medication. And then with the bamlanivimab, which is that outpatient monoclonal antibody, we've got over 300 doses available. As Casey said, the city at this point is able to demobilize the infusion center, and we'll be able to move those infusions that required back to the hospital. So we're obviously setting up our process at Northwest to continue to offer that drug to anyone that qualifies through their primary care physicians. And right now we only have 4 staff who are quarantined. That is down from upwards of 150 about 2 to 3 months ago. So we're really in much better shape in regard to staffing. We've been asked, how's Northwest Texas going to respond to the governor's declaration? What I'll tell you is right now we have no immediate plans to change what we're doing with regard to mask requirements and visitation. We will be speaking about it and we will be monitoring the situation closely. But our first priority is to protect our patients. Our second priority is to protect our staff. And until we're sure that the coast is clear, we're going to keep our guard up. I am very optimistic that we will be able to go from 1 chair to 2 chairs in the lobby in the very near future. That's all I have today. Thank you.
Thank you, Dr. Weiss. Let's now go to Dr. Michael Lamentier, Chief Medical Officer for BSA. Dr. Lamentier, how are you?
Good morning, David. I'm doing well, thank you. Good morning, Amarillo. And I'll start off with some of our statistics today. And again, the good news on stats is that we're seeing declining numbers of patients in our hospitals and our facilities that are COVID positive and requiring hospitalization. Again, we think that's a combination of the vaccines, probably some herd immunity that's occurred in our city because of prior infections, and also what we've been doing with masking and social distancing. So the downgoing trend is obviously encouraging, and we're happy to see that. Today, we broke through a new record low of less than 20 patients in the hospital. We're at 19 today, and we haven't been less than 20 for months. We've been hovering in the 30s or so the past several weeks, and the decline in numbers down to less than 20 is certainly encouraging. Although we should not be letting our guard down in the setting of those patients that are now fewer in the hospital setting. Only 7 of those patients are in our intensive care unit out of the 19 that have COVID, and 3 of those 7 are on the vent. I think it's pretty interesting that of the patients that we've had in the hospital that are requiring ICU care, that statistic of about 50% of those in the ICU required mechanical ventilation has held true since the beginning of the pandemic. That has not differed. So if you are unfortunate enough to be hospitalized and require intensive care unit stay, it's a 50% chance that you're going to be on the ventilator. And that's a scary statistic. There are not many other illnesses that we could say that lead to that type of profound respiratory failure with such a high incidence. Our respiratory triage numbers are coming down. They're about 20 per 24-hour period. And again, we continue to see very, very low rates of influenza, very low rates of respiratory syncytial virus, also known as RSV, which is a common pediatric cause of infection in the respiratory tract, and especially in the winter months. We attribute that to masking and social distancing. That's the only thing that makes sense that would lead to those 2 viruses having such low incidence rates this winter and this past fall. We are seeing now about 30 of our total ICU beds are occupied with a combination of COVID and non-COVID patients. I mentioned 7 of those in the ICU are COVID patients, which is markedly diminished from where we were. Our testing numbers for COVID are also down. We finished February at 5.6% of all of our tests positive for COVID. That's a combination of inpatient and outpatient testing. And in March, so far month to date, it's only a few days, but we're down at 4% of all the tests we've done in March are coming back positive. Ongoing downward trends, especially since you'll recall that we were at a level of 34% of all of our tests were positive back in November that we were doing. We only have 3 staff quarantined, a very nearly identical number to what Dr. Weiss said at Northwest. So out of the 2 hospitals in the city that are, and Dr. Gonzalez will chime in on his piece as well, but the 2 larger hospitals, only 7 staff are quarantined, which is amazing compared to where we were before, earlier during this pandemic. I will also say that over the past several weeks, of those staff that we've had to quarantine, none of them are vaccinated. None of them have been vaccinated. So we continue to stress with our staff, even those individuals who were previously infected, that vaccination is critical. There was a study that came out recently that looked at individuals who prior had infection with COVID-19 and subsequently received at least one dose of the messenger RNA vaccine, whether it be Pfizer or Moderna. Those individuals had a very brisk immune response, which looked superior to those individuals who were never infected and had 2 vaccination shots, suggesting that the level of immunity you're going to achieve with at least 1 vaccination dose, in addition to a prior history of infection, is going to be a much better way to protect yourself and others from subsequent infection than no vaccination, especially when we have a lot of unknowns related to the variants, the potential for severe disease, the potential for moderate disease, which could also lead to hospitalization, as we know. We continue to have a lot of opportunity with monoclonal antibody therapy. If you meet the criteria for a higher risk patient who's been recently infected, please get a visit with your PCP, your primary care physician or provider, to get an order to have this consideration for a monoclonal antibody therapy. We can do this at our BSA Urgent Care Center with an order from your physician. And I know that Northwest is also offering this service, and Dr. Weiss has provided that information to you as well. Again, we need to continue to be vigilant with masking. We will not change our masking policy at BSA in the setting of the governor's order. We are excited that we're able to start getting back closer to a sense of normalcy in Amarillo. We are all very happy about that. In the healthcare setting, in our facilities, masking will be mandated still. It is critical to protect our staff, to protect our patients. We are not at the point yet where we've had enough people vaccinated to be letting our guard down, especially in a setting where the incidence of disease is higher and the risk of having somebody who's immunosuppressed and at higher risk of having a complication if they're infected is also higher. So again, I'll echo the governor's message. And if you read his executive order, he also says there that we don't need to change what we're doing to get where we are currently today. That is, keep doing the right thing with masking. It's just that the mandate is no longer going to be in place. So we're happy. And again, we're excited about the next upcoming months and hopefully ongoing low numbers of COVID. I want to thank all the healthcare workers in Amarillo from all facilities that have spent a lot of their hours over this past year taking care of patients and giving everything they've got. And we owe them a lot, those that are on the front lines and taking care of our loved ones. That's all I have today. Thank you.
Thank you, Dr. Lemonier. Let's now go to Dr. Rodney Gonzalez, Director of the Amarillo VA. Dr. Gonzalez, how are you?
I'm doing well, David. First, thank you. Let me first talk our numbers. So for COVID-19 patients at the Amarillo Hospital, we currently have 0 in our ICU. When you look at our positivity rate, last week, our positivity rate of veterans who got COVID testing was 2.8%. And this week, it currently is sitting at 0.5%. Now, we have vaccinated approximately 25% of our veterans across our healthcare system around all of our campuses, and we have a team in Clovis right now doing vaccinations there. We want to encourage our veterans who want to be vaccinated to get vaccinated. I have made the decision to not have any age requirement for veterans that want to be vaccinated within our healthcare system. And so if you are a veteran and you want to be vaccinated, I would ask that you please call us 806-355-9703, press option 2 so we can get you scheduled for an appointment. Now, we prefer to do scheduled appointments. We do have walk-in capability to accept some walk-ins. We prefer the scheduled appointments to ensure that we're going to have enough vaccine present, also to minimize any risk of wasting vaccine at the end of the day. But there's also a benefit for the veteran. If you use the beneficiary travel and do a travel claim when you come to appointments, when you have a scheduled appointment, you get paid for both ways, two-way travel. When you do a walk-in, you only get paid one way. So that's another good reason for you to make that appointment, so we can make sure that through your travel claim, we'll pay for both ways. It's important to note that we are vaccinating all veterans eligible for care. We are also vaccinating any approved caregivers through the VA Caregiver Support Program, and we're vaccinating any spouses who are enrolled under the CHAMP VA program. The one thing I want to highlight on the CHAMP VA program is at age 65, those spouses roll over to Medicare, and so we are no longer part of CHAMP VA. And that's by statute, so that's what we have to follow. Now, mask requirements, everyone's talked about it. Number one is we want to make sure that our patients, our veterans, our visitors, our staff are in a safe environment. And we are still requiring the masks to be worn when on our campus or in our facilities. Now, that's why we're doing it. Now, we also are doing it for other reasons. Number one, we are a federal campus, a federal site, and so we have to follow the federal guidance. And there is currently a presidential executive order which requires masks to be worn on property and any facilities, whether they're owned, leased, or rented by the federal government. And also VA has its guidance in the Veterans Health Administration of wearing masks within their facilities. And so I do want to just remind, I have told our staff this morning, but I'm also want to remind our visitors and veterans that on this campus and on all of our campuses, we will still be expecting everyone to be wearing their mask. With that, I just want to say today marks the 90th anniversary that President Hoover signed in to make the Star-Spangled Banner the national anthem. And so just want to highlight that. If you've been to any military celebration or things with veterans, you know that national anthem is valued upon our military, and it's part of those ceremonies. And so just wanted to highlight it. I want to thank some of our community partners. We've had the Elks Lodge in Childress and the VFW in Clovis that have agreed to allow us to use space in their space to give these COVID vaccinations. Some of our outlying rural communities are very small, very difficult to bring in a larger number of veterans to vaccinate. And so very appreciative of their effort in partnering with us. With that, I just want to thank the Civic Center, because while their focus has not been specifically on veterans, their focus is on the entire community. I know many veterans have gone there to be vaccinated. And so whether it's within your local community, the Amarillo Civic Center, the Lubbock Civic Center, or the Lubbock area, I know the public health communities have been doing an outstanding job getting their communities vaccinated. So thank you. And with that, I'd like to thank the city of Amarillo and all of our communities in the Panhandle for their support to our veterans. Thank you.
Thank you, Dr. Gonzalez. Let's now go to City Manager Jared Miller. Mr. Miller, how are you today?
Doing good. Thanks, Dave. I want to remind everyone that our drive-through testing site is still open. If you feel you have symptoms consistent with coronavirus and want to get a test, please call Public Health at 378-6300. They will screen you over the phone and refer you to the drive-through testing site. Also, if you need transportation, either to the testing site or to the vaccination center at the Civic Center, please call Amarillo City Transit at 378-3095. They will schedule a trip for you here and also back home. So we want to make sure that transportation is not a barrier to people getting tested or, more importantly, vaccinated. Right now, we are working under Governor's Executive Order GA-29 and GA-32. 29 requires face coverings when out in public. That executive order is in effect until next Wednesday. GA-32 stipulates that our businesses are limited. The primary thing at this point, that the primary restriction at this point associated with GA-32 is that our businesses are limited to 75% occupancy, and bars are limited to 50% occupancy. And that, again, will all change next Wednesday. It bears noting that GA-34 that takes effect next Wednesday, and we'll certainly talk about this in great detail next Wednesday as well, removes all occupancy restrictions. So there's two primary things that it does. It removes all occupancy restrictions, and as the mayor said, completely opens up business in the city of Amarillo. It also supersedes a number of previous executive orders, including GA-32 and GA-29. So we will no longer have a governor's executive order mandating the use of face coverings when out and about in the public. However, It's important to note that in the governor's comments yesterday during the press conference, where he said removing mask mandates or the mask mandate does not end personal responsibility. Also in the executive order in 2 locations, it strongly encourages the wearing of face coverings and strongly encourages the use of good faith efforts and available resources to follow the Texas Department of State Health Services health recommendations, which includes the wearing of face coverings. So I think very clearly the governor is indicating that it's responsible and strongly encouraged to wear the face coverings when you cannot maintain social distancing or when you're in a setting where you're out and about in the public. So with regard to GA 34, it will open up all of our businesses to 100%, and it will supersede all or a number of previous executive orders, including GA 29. Now, I also want to touch on a couple of things that touch on federal activities that we participate in, much like Dr. Gonzalez was talking about as far as the federal facilities that he manages. Our Amarillo City Transit is under a FTA, Federal Transit Administration guidance, that anyone riding on transit resources that are funded through federal sources must have all of the people on those buses wearing face coverings. So that is something that people need to be aware of if they're going to be taking advantage of the public transit system. We also, with regard to face coverings in city facilities, because the governor has strongly encouraged the use of face coverings and strongly encouraged compliance with DSHS guidelines for the prevention of transmission of coronavirus, we will continue to be what I hope is the very best example of sticking to the recommendations and guidelines of the governor. To that end, we will continue in City of Amarillo facilities to require face coverings of all of our team and of people coming to those facilities. And that's to better manage those in-person interactions and prevent or reduce the transmission of coronavirus in as much as we can. So that's all I have, Dave. Be happy to answer any questions at this point.
Thank you, Jared. Let's now go to members of our media who are in attendance. If you have a question for an individual panel member or the panel as a whole, that's completely fine. Let's go ahead and start with, if I'm not mistaken, Cassie Hamilton from News Channel 10, KFDA. Cassie, how are you today?
There we go. Can you hear me now?
Yes, we have you. Cass. How are you today?
Doing good, thank you. I did have a question for Casey in regards to the Saving the Seniors program. I didn't know what role the city was playing, when it will start, or if you had any more details on that.
That's a great question. So the Save Our Seniors program is a specific state initiative that's being rolled out through the Texas Department of Emergency Management and the Texas Military Force. We have a similar project that we're rolling out here in Amarillo that we're working with our Meals on Wheels program and the Area Agency on Aging. And so we are certainly working to make sure that those seniors are being able to be vaccinated.
Awesome, awesome. Do we have any word yet on opening up the vaccine to more categories?
No, that is a decision that's made by the state, by the Department of State Health Services. And so there'll certainly be more information as those decisions are made and we have information that's pushed out by the state.
Sure. I also wanted to ask if you guys had any reaction to the National Institute on Health saying yesterday that the plasma treatment isn't proven to be beneficial.
I would just say that, you know, we did some early plasma treatment at Northwest, and in our hands, we did not see a significant difference in how patients were doing. So we actually stopped using the plasma treatment fairly early on in the pandemic.
I would concur with Dr. Weiss's statements. I think we've said this before on some prior news conferences, probably a couple months ago, that yes, that was an early treatment that was felt to be potentially helpful. There were some randomized trials that were done to look at plasma infusion, especially for patients with more severe disease. And plasma infusion did not show to be beneficial, especially for individuals that have some more severe COVID infections.
I think the thing to remember, though, is that the blood center still needs blood donation. Blood is still a very critical component of medical care. And so even if you're not necessarily specifically donating for this cause, it's still very important that we have a good blood supply and that we have lots of donations. So please still consider donating blood to our blood center.
For sure. Awesome. I think that's all I have.
Thank you, Cassie. Let's now go to Dalton Williams of KBII Channel 7. Dalton, how are you today?
I'm good, thank you. So my first question is kind of a 2-for-1 question for the whole panel. Do y'all think it's too soon for us to be opening up everything and ending the mask mandate? I know we're doing good on vaccinating everyone and all that, but do you think it's too soon to end all this? For anyone on the panel.
Yeah, I'll jump in and say that I think it's a little bit too soon. I wish that we could have vaccinated more people. And so I think that's going to be coming soon. But yeah, I'm a little concerned that it's maybe a little bit too soon.
Yeah, I'll add, and I'll concur with Dr. Milton with the simple fact that it'd be great if we could have more people vaccinated. I think it would be great if we could, I have no problem with personally augmenting capacity in businesses, but I think that doing that coincident with removing the mask mandate, to me, is a little counterintuitive. With that being said, again, because the mandate's gone, the recommendation from our governor is not to stop masking. And I think it was made clear by Jared and myself earlier on this conference that we're still expecting Texans and Amarilloans to do the right thing and wear masks where appropriate.
Yeah, I would absolutely concur. I think Dr. Lamentier said, I think it's important that we all continue to do what we can do to protect ourselves. And they said, you've heard it. The hospitals and the clinics are still high-risk locations. And I think you're going to find that most of these locations will continue the same practices, knowing that we're still not in the clear yet until a higher percentage of the population is vaccinated.
And I think the other thing to remember is that we don't know when we interact with someone if they are at high risk or not. And so it's important that we still are considering one another and are wearing our masks to protect ourselves and to protect each other, because we don't know the situation that everybody that we encounter is in.
Exactly. And then my next question is there any kind of concern of a possible spike because of this order?
I think we're always watching the numbers, and that there's always a potential if we let our guard down for those numbers to turn around. I think, our hospitalization rate, our infection rate are always very vulnerable to if we stop using those public health mitigation measures. So again, it's important that we continue to do so.
I think a good analogy is if you've ever had surgery and, the first few days you feel terrible and then you're feeling better and you start thinking, you know what, I'm having a really good day. I feel good. And inevitably you overdo. And then you pay for it for several days after that. So you were feeling great, and then you actually did too much and you end up taking steps backward in your recovery. And so I just hope that as a community, with this new freedom that we have in businesses being open and no longer mandated to wear masks, that we don't overdo, because we are on the right track to recovery. And I don't want overdoing to actually set us back in our recovery as a community for COVID.
Okay, awesome. Thank you so much. That pretty much takes care of all my questions. Thanks for having me.
Thank you, Dalton. Let's now go to Aaron Langston of KAMR Channel 4. Aaron, how are you today?
Pretty good. How are y'all?
Good, thank you.
First question is, I'm looking at the state numbers yesterday. Our hospitalization rate jumped up just a small little bit, but it looked like the number of licensed beds in the region had dropped some. And I was wondering if any of our hospitals were some of those that had a reduction in bed.
No, I mean, our licensed beds are the same as they have been since the beginning of the pandemic. We have 445 licensed beds. but that is not where our ADC or average daily census runs, as we've talked about. At the peak of the pandemic, you might recall we were up as high as 375 patients in the hospital. But our average daily census typically runs more about 270 to 280 in that range. Today, we're at 274 total patients in the hospital, but our denominator, the licensed bed number, has not changed.
Yeah, it's the same thing. We talked about early in the pandemic, or some of the real surges, how the hospitals were trying to exceed their capacity in that sense of trying to create new beds and new capacity. But in terms of just the total licensed beds, that has been a solid number, as unchanged at any of the hospitals in that sense.
All righty, thank you. And this one's for the mayor and Mr. Miller. Was there any communication with the governor's office before his announcement yesterday, seeing as Amarillo has, over the past few months, been one of the hotter areas for COVID, concerning the rescinding of the mask ordinance and bumping up the capacity of businesses?
There was no communication to the mayor's office.
Correct. And other than knowing that a press conference was coming, we had no communication as to the content of that press conference.
Alrighty. And what concerns do y'all have with this rollout coming 6 days away? That some people might see it just as a reason to skip all of the things we've looked at and learned over the past year.
Well, I think we have that concern, but I'm trusting that citizens are going to make wise choices. You know, like Dr. Milton said, use your head, and we're not going to overdo. We're going to continue taking the advice of the people we trust on this panel here, who are counseling us to continue to wear masks, to continue to make wise choices about social settings. And we're not going to overdo and set our community back. We're going to just continue along until we're through this, till our vaccine percentages, really until everyone in our community who wants a vaccine has had the opportunity to get the vaccine. That's the target that I'm aiming for.
Aaron, I would say what we're talking about is even though the state mandate is being lowered, I think you have to realize that individual institutions are going to continue to mandate masks, like hospitals and clinics and all. And what I'd ask is that each of us be respectful for those institutions where they continue to require that for good reasons. And so, yeah, that's going to be important that we just have that respect for each other.
I think our communities learned in many ways the hard way how to dig our way out together over the last handful of months. And I think it's appropriate that as everybody knows, our community has a variety of different opinions on face coverings. But when push came to shove, our community banded together and did what they needed to do, whether it's from a face covering standpoint or sanitization or the large gatherings, all those things to start driving our numbers down. And we have a horizon where we can see a point in time where everybody's going to have access to the vaccine that wants one. So I think that regardless of our opinion on face coverings, I think our community is going to do what they have to do to help us stay healthy as we hopefully are going through the last phases of this current pandemic.
All righty. And we're roughly about 2 weeks out from I guess the first case we saw here in Amarillo 1 year ago. What have we learned as medical professionals and a community and community leaders over this past year?
I think we've all kind of learned that you can do more than you think you can.
I think we've learned an amazing. I mean, that's way too big of a question for us to be able to answer here. We look at our jurisdictional coordination. We look at our coordination with our hospital providers. just the daily and weekly communications that this group has, maybe without the press, but also with the press, and ways that we communicate with our community, ways that we coordinate with other jurisdictional entities. The level of coordination and communication is so much better. So we will have benefits that come out of this very trying year, or a little more than a year now that we're, until the end. Operationally, we've learned how to stay fully effective while utilizing telephonic work and some other things. How we continue that going forward is, something we're going to work out. But I think we could go on and on and on with the amount of things that we've learned through this process, both from a coordination, communication, operational effectiveness standpoints. There's more. I'm sure I'm leaving them out, but that would be a huge conversation all to itself.
Yeah, and Aaron, I would say I have learned not to eat spicy food for lunch if I have to wear a mask all afternoon. But I think, seriously, I think the biggest thing is I've learned how incredibly supportive this community is. I mean, people were struggling in this community, and yet they continue to support the hospitals and the staff. And it just incredible outpourings of generosity. So that has been a huge just insight for me in the last year.
Yeah, I would agree with that, with all those comments made, and it is a very big question. But simply put, for me, is that I think we've learned that the medical community in Amarillo and the city leadership was able to pull together and accomplish great things in the setting of a very serious pandemic. To be as successful as we've been with creating hospital capacity to take care of sick patients at unprecedented numbers in terms of intensive care, taxation, and what types of support services we needed, whether it be staffing, equipment, et cetera, we were able to get that done. And we did not have to send patients out of Amarillo to take care of them. We didn't transfer patients to other hospitals because we couldn't handle them. We took care of everybody here in our city, which is an amazing feat. And there were times when I think we were concerned we weren't going to be able to do that, depending upon what peak numbers we were going to experience as far as COVID patients in the hospital setting. And then for what was accomplished with the city with vaccinations and such a mass number of individuals being vaccinated as efficiently as they have been, this is an extraordinary feat accomplished. And we're tooting our horn a little bit here. I am, for the city and the facilities. And that includes all the facilities. That includes the private medical offices that were vaccinating as well, that were managing these patients. This is very much an accomplishment that we need to be proud of.
I think the Panhandle spirit is alive and well. We took a bad situation and we worked together, and it highlights the grittiness of our team and the toughness of our teams and the stick-to-itness of our teams, and how much we still like each other. That's a big deal. We've worked 7 days a week, sometimes 14 hours a day with each other, and we still like each other, and that's a big deal. I've seen some of these people more than I've seen my own family this year, and they're amazing people. And so I learned that I do not want to go through a situation like this with another group of people. We have amazing people here in the city of Amarillo. And so I've learned that I'm really, really proud to work and to live in the city of Amarillo.
I think I've learned that the best decisions are those that are based on facts. In this situation, it was fluid, and it took a lot of patience to actually learn the facts. And even on a weekly basis, I really appreciate hearing the medical expertise about what drugs are working, what responses they're having with treatment for COVID in the hospitals. So I've grown a lot in patience, and I've watched this team grow in patience, even though we had to make decisions and respond. And we always want to do that on the facts that we have on hand. Facts are sometimes ever evolving. And I've appreciated the continued work to gather those facts. And I've appreciated our community's patience and grace and willingness to learn as new facts are discovered. So I think those skills the willingness to learn, willingness to continue to evolve are, I think that's the biggest benefit that we as a community take away from this. We'd like to get stuck in our ways. We'd like to do things the way we've always done them. But this is going to require us to continue to change, and through change, every change is an opportunity to improve how we're doing it. You can take the vaccine clinic as a perfect example. It's been open about 9 weeks now, 10 maybe, and daily, sometimes hourly, it changes in the way that it's operating. So they continue to learn. They have an open mind about that. They get facts on how to improve it, and then they evolve, and then it's better. So that I appreciate the pioneer spirit, born and raised here in the Texas Panhandle, but I would love it if the pioneer spirit was synonymous with a willingness to learn and evolve, because I think that's will make us stronger and successful going forward, whether it's a pandemic, whether it's a historic freeze, or whatever is next that will challenge us as a community. I agree, we're going to do it together. But I think that togetherness is now strengthened by this willingness to learn based on facts, and will be better because of this ability that we have to evolve.
All righty. Thank you all very much. Those are great answers to a very broad question. And I think that has me covered for the day. Thank you.
Thank you, Aaron. Let's now go to David Gay of the Amarillo Globe News. David, how are you today?
I'm good. Good morning, everybody. Just a few follow-ups. My first one is for Mr. Miller. With this this new order coming in from Governor Abbott, will the city continue to host, I guess, remote meetings, virtual interactions with those residents who would prefer to meet with city officials in that fashion?
Yeah, we're going to continue with the virtual meetings for now. Of course, we're going to reevaluate that on a frequent basis going forward. However, the virtual meetings were not connected to GA 32 or 29. They came about as a result of the governor's initial executive disaster declaration and were substantiated by the attorney general. So we didn't do that until the governor and the attorney general had both spoken up on that topic. And the purpose of those that guidance from the governor and the attorney general was to limit face-to-face meetings, in-person meetings, so that we could better manage coronavirus and limit the transmission of coronavirus. So we're going to continue doing that. And I think the biggest determining factor on when we can go away from that, go back to in-person meetings. One, I think telephonic and video conference meetings is going to be likely a tool to use in certain situations going forward. But I think the key metric on when we trigger in-person meetings, at least in most of our boards and commissions, is going to be when we get to a level of vaccination that public health and others feel like it's the right time to move forward with in-person meetings.
Okay, fantastic. And then I guess my next question would be for Casey. You spoke about the city's infusion center being closed. What is the reason for that?
So we are seeing fewer and fewer patients who need that service, and so it's just time to demobilize that. We have some contract staff that are working that, and so we have reallocated some staff for that. And so with reduced need, then it is acceptable to just move that service back to the hospitals and to the clinics, because we're just not seeing the need for it anymore. If a time comes and we have another surge and we need to reopen that, then we certainly can. But right now we're able to demobilize that.
Absolutely. And I guess the last question is that I have today is, is there any word from the state, whether it be for the city's vaccination clinic or even to the hospitals, on receiving the one-shot Johnson & Johnson vaccine?
Not yet. So those allocations are made fairly close to the time of shipment. And so you will certainly be open to whichever products are sent to us, but we don't have any word right now as to which ones that will be.
But I think it's important to note we have been making plans on how we're going to handle having multiple types of vaccines so that we can communicate to the public so they can know what their options are and they can make choices based on, what they want to do, depending upon our availability of those vaccines. But we're making, when we get those additional vaccines, we will have a plan in place that's going to enable people to know what's available, where, and how they can get whatever they want.
Absolutely. I think that's all the questions I have. Thank you, guys. I appreciate it.
Thank you, David. Those are all the questions we had for our media members today. This concludes our weekly news conference for the latest in COVID-19 information for the Amarillo community. This is David Henry. I'm the communications manager for the city of Amarillo. I want to thank all of our panel members who took the time today to provide this valuable information to our community.